So when I heard that Tampa General was offering the COVID-19 vaccine, I immediately knew that I needed to have my hand in a part of it. I want to help stop the community spread. I'm fortunate enough to not have been affected by COVID-19 myself, but just seeing the worst of the worst and seeing what could happen, I really did not want to find out if that could be me if I were to be infected with the virus. So I wanted to help, one, the community, and then myself and my family.
Just for a little background, your role with COVID-19 at Tampa General Hospital, what have you seen in the past 9 months?
I don't think I can put into words what I've seen, but if I could think back through the past 9 months, we've been through innumerable challenges, despair, grief, watching families say goodbye to their loved ones over FaceTime was devastating. Not being able to have visitors while patients were gravely ill was devastating. And truly the thought of having to go through another surge like that, it's heartbreaking. So I want to do whatever I can to prevent that.
Give me your title if you could.
I am a registered nurse in the medical intensive care unit.
So when you came to work today, knowing that the vaccine was likely arriving at Tampa General, were you excited? Were you nervous? Give me an idea of the emotions.
I was excited. I actually had my appointment originally for this morning. Then it got postponed, and then I had one for tomorrow. So when I was told that there was an opportunity to get it this morning, when I originally had my appointment, I immediately volunteered.
That's just amazing. What was it that made you want to be in, quite literally, the front of the line?
Well, we've been in the front line throughout this whole pandemic. We cared for the first COVID positive patient at Tampa General, so I felt like it was right for one of our own to be the first person to receive this vaccine so we can continue helping the community.
Tell me, did the vaccine feel any different than any other shot you get?
No, it felt just like any other vaccination that you would receive.
How do you feel now?
I feel fine.
Was there ever any worry about any kind of side effects, or how you
No.
did you feel like you got that information?
No, I am a firm believer in science. I trust what our scientists and researchers have been doing. I'm well aware of the type of vaccination that the COVID-19 vaccine is, how it's an mRNA, and just how the background works. So I felt confident in our researchers that they were giving us the protections our body needs to fight this virus.
What would you tell other healthcare workers, not only frontline healthcare workers, but all healthcare workers who are going to have the opportunity to do this? Some people I think are really thinking hard about it. What would you say to them?
I would say for them to do what they're comfortable with, but to also think of the common good and what's best for the society as a whole. That many other people were in the research trials prior to the administration of this vaccine. So a lot of the side effects are understood, and I think that's a common misconception is people are nervous about what's going to happen if they receive the vaccine. But I think what a lot of healthcare workers don't realize is a lot of this has already been studied and we're aware of the common side effects. And again, just to think of the common good and what we can do for our community and country and world as a whole to get us back to normal.
I'm sorry. What about the community? What would you say to the community? I mean, that's a kind of a bigger issue.
Yeah, to the community, if you want us to get back to our normal, you should really consider getting a vaccination, especially, if you are high risk. It's very important. But if you have a loved one who is high risk, it's also very important. I think a lot of it is just setting yourself aside and thinking of what's best for the community as a whole.
So I was there when they kind of walked you into the room today and set you down. Not everybody gets a shot in front of literally dozens of television cameras and live streaming quite literally hundreds of thousands, if not millions of people were watching at that moment. What were you thinking when you came in and sat down?
I honestly wasn't too nervous. I think Raphael was more nervous about being watched giving a vaccination, but I had faith in him, and he did great. It didn't hurt at all. He did a really good job. So I was more nervous for him. I wasn't nervous about getting a shot. I give shots, all day long. So I wasn't too worried about that part.
Again, just the importance of this. I mean, we've known about the virus for now well over a year. It's been in America for well over 9 months. This vaccine is hope.
Mm-hmm.
Talk to me about that.
So I think of it as we've been through a very difficult time these past 9 months. And if there's just anything that we as healthcare providers or the community can do besides social distancing and wearing our mask, this vaccine is what we have been waiting for. This is what we need to do to get back to our normal.
Talk to me just one more time, because you said it so well. The science behind this. This is not a guess. This is rooted in investigations. This has been tested and looked at and retested and looked at. Just the confidence that you have in this and how other people should feel when the time comes for them to make a decision if they're going to do it.
Right. We have scientists and researchers that have worked tirelessly for this vaccine, and I trust in them that they've done everything in their power to find the vaccine that will help heal our community. I am confident that they've come out with a vaccine that will be able to end this pandemic and to get us back to our new normal. Messed that one up.
Is there anything that you feel that people should know about COVID-19 and what you've seen in your day-to-day and the hope that you now have, or anything that we haven't talked about?
Well, with COVID-19, the terrifying part of it as a frontline worker is we don't know which person walking into the ICU is going to walk out of the ICU. There have been numerous middle-aged 30, 40-year-olds that walked right in who unfortunately never made it out. And those necessarily weren't the ones that we thought would not make it. So it's very indeterminate on how this virus will affect whom. So I think it is important for our community and healthcare workers alike to know that and to be aware and be proactive and help prevent community spread.
If you could just timestamp for me, I mean, I think you got the vaccine 6 hours ago or something like that, how you're feeling right now. But again, just saying, about 6 hours ago, I was one of the first in the country to get it, and I feel X. I've been at work all afternoon, or whatever it is that you're going to say.
All right. So about 6 hours ago, I was the first nurse in the Tampa Bay area to receive my COVID-19 vaccination, and I feel great. I've been working all day, so I urge you all to do the same.
Is there a message that you have for anybody, whether it's about COVID, whether it's about the vaccine, whether it's about making smart decisions for yourself and your community? Is there anything that you have for that? You could probably go on and on. I'm sure that you say
Oh yeah,
all the
there's
time.
so many. That it's just not about you. It's about everyone else. We can't be selfish in this. This is not the time to be selfish. This is just time to think about our community and what's best for our family, our children, all our vulnerable patients. It's the time to come together and do what's best for everybody. Set politics aside and start believing in science.
Is there anything I didn't ask that you'd want to add?
I don't think so. No, we're good.
Is there anything that I didn't ask that you think is important to share with other healthcare workers or mothers or politicians?
No, I did it for my community, myself, my family. Especially recently, my child's daycare worker got COVID, so we spent a couple weeks quarantining. We never got COVID, but it was still terrifying while I was waiting for my test results. And it kind of hits home, oh no, could it happen to us? Because you don't know who's going to get mild symptoms, who's going to get devastatingly terrible symptoms. So
That is kind of the scary thing about this virus.
Yeah,
It's
it
random.
truly is. It is. And I've truly seen 30, 40-year-olds walk off that stretcher from the ER, get cannulated on ECMO, and never make it out. And then we've had some, like 80-year-olds, do fine. And so it's scary. It makes you realize your own mortality, but sometimes it's a little too late for that. So it's been tough.